Now it's time for today's perspective. And every single year, 2 million women around the world are diagnosed with breast cancer. It's a startling figure that throws, of course, a time bomb into any family. Well, today, the world is marking Breast Cancer Awareness Month, a chance to look at all the latest advances, show as well support for those living with and recovering from the disease. Well, with me is a medical oncologist at one of Europe's leading cancer centres, the Gustave Roussy Institute, Dr. Joana Ribeiro. Thanks very much for coming in and talking to us on the programme today. I know this isn't your specific area, but presumably at the beginning of the process, if you like, what you and your colleagues are trying to do is about prevention in the first place and about screening for women as well.
Yeah, good morning, that's for sure. So in Gustave Roussy we have a strong prevention program in which there are several trials that are aiming to better personalized screening strategies. So today we do screening that is the same for every woman. We are developing methods to personalize that screening based on individual characteristics.
And once you get beyond that, then of course it's about treatment and support for people who have been diagnosed.
Yeah, you're completely right. I think there are two different important parts. There is the treatment part, in which we try, of course, to bring innovation as fast as we can to impact people's life and to increase the cure rates. And then there is this another important part that perhaps, and most of the times, it's a little bit neglected, that is the survivorship. Because we must acknowledge that women with breast cancer are living a lot today. We are curing a lot of patients, and this second part of the support is really something that we are focused also with developing innovations like digital devices, like wearables or smartwatches that can give us a more real-time picture of how patients, for example, are coping with treatments. And I think this in the future will be very interesting because it will allow us to personalize lifestyle interventions. It will allow us to make, to detect toxicities earlier, and it will change the philosophy from a fragmented care to a more continuous patient care and more centered in patients. So I think this will be a major game changer.
And I know you and your department, the big thing that you really feel very strongly about is that personal approach.
Yes, completely. Personalized approach. We try to give it during all the pathway of the patient. We talked a little bit about the survivorship, but this personalization starts at the beginning, at diagnosis. And it focuses not only on the patient, but of course only on the tumor characteristics. And we have seen an example how different tools are allowing us to personalize treatment. For example, this year there is a very nice AI-derived tool that was mostly based in France, developed in France, that will hopefully allow us to personalize even more treatment. What I mean is that, for example, today I see a patient, she has some clinical characteristics, a tumor size that corresponds to a specific lymph nodes that are involved, and we know that for all patients with these characteristics, we should give a drug that carries toxicity, but does not carry the same efficacy to all. So now with this AI-derived classification, in addition to the standard clinical characteristics, we are able to identify those patients that probably will really need this drug and those that have an excellent outcome, irrespective of having the lymph nodes involved, and that will only get the toxicity of the treatment. And of course, as we bring innovation, as we bring new treatments, we are raising cure, but we are also bringing some toxicity. And that's why this personalization is so important. And it's interesting to see that this personalization is coming from different informations. And these AI digital pathology signatures that we were able to develop, they were developed in a retrospective cohort. So we are now beginning to design the clinical trials that will allow us to validate their use.
It's incredible to hear a good story for once about AI, because we hear so many negative things. I mean, the way that things are developing, are you impressed with the advances that have already been made, if you like?
Yes, I think we are starting to see a little bit that transformation in the clinic. I think as I share your vision, and I think most of the times we see signatures and characteristics that are developed, but seem a little bit theoretical. But I think now we are starting to grasp their application in practice. I think we are starting to do this step in which we are really grabbing these signatures, all this information, are putting them in clinical trials and see if they work.
And how much is enough? I mean, is enough being done to try and combat the problem? I mean, obviously there's only a limited amount of money, there's only a limited amount of staff, but could more be done still?
Oh yes, I think we have so much to learn. Biology is something that is amazing. And you talk about costs, but for example, this signature is very simple. It's based on an evaluation of one slide of the tumor. But well, research is so important. There is so many things to learn about the tumor, even about the host, because we are a lot of time focused on the tumor and we forget the host. And there are so many insights coming from, for example, from the microbiome that we are starting to grasp now, but we'll need a lot of investment. And I think it's never enough.
Well, it's good to have some hope within the discussion as well. Thanks very much for coming in and talking to us on the programme today. Dr. Joana Ribeiro from the Gustave Roussy Institute nearby to here in Paris. Thanks very much once again.